Thanks, Premier. Certainly the numbers today are reasonable in terms of how it's been in recent days. I think it is important to make the point that we have seen fluctuations. We've seen very significant ups and downs with numbers that can occur with batching of results from our laboratories. But the trend overall is that we're kind of sitting at 400 to 500 cases a day. That is relatively flat over the last week. We are now looking to see the effects of various interventions. Obviously, masks may show in the numbers in days to come, and obviously the stage 4 restrictions will show after that. That's what we're looking for in the numbers now, but we certainly don't hang on a single day's result as being indicative of too much. We're looking at those 5-day averages, 7-day averages in terms of how things are going.
Brett, how many cases is now seen in the disability care sector? Do you have any data on that?
I haven't got today's data. We've had a few cases, so there's been a very small number in disability settings, but it's another vulnerable setting. We certainly want to make sure that it is protected to the fullest extent possible. There's obviously guidance for those disability settings around how to mitigate that risk as much as possible, but those are vulnerable individuals, so anyone with chronic illness, not just elderly individuals, but anyone who's had a long-standing medical condition is also more vulnerable to more severe illness, and that obviously applies in disability settings.
A special control being put in place so the failures of aged care aren't repeated?
Certainly the workforce is a little bit more stable in the sense of not working across as many locations as has been the case in aged care. That's one positive in terms of the disability sector, but there is specific guidance on all of those public health interventions that we know are useful to reduce the risk of transmission. They're still basic things: hand washing, absolute exclusion when you're unwell, trying to keep a distance to the fullest extent possible, and wearing the appropriate personal protective equipment when dealing closely with clients.
And have you got any latest data on
So hospitalisations as of today are that we have 607 currently in hospital. That's an increase of 69 since yesterday. There are 41 patients in intensive care. That's a decrease of 1, and 28 ICU patients are on ventilators.
Brett, everyone's got their opinions about when we expect to see case numbers fall. Can you give an indication of when we might see that happening, or is it just too risky to make that prediction?
Crystal ball gazing is not a particularly useful exercise. I think having seen stabilisation in numbers, that's a positive. We do expect within 14 days of a really significant intervention that we'll see a change in numbers. So certainly 14 days from the really widespread implementation and the behaviour change that happens with stage 4 restrictions, we'll get a different average daily numbers, I would expect. Again, it'll go up and down on a day-to-day basis, but within 2 weeks I would expect it.
Brett, can I ask on the healthcare workers, 911 of them are active cases. Are there healthcare workers that are getting this repeatedly, that are catching it more than once? And with 911 active health workers out of the system, what does that do to staffing levels?
Certainly it's a concerning number. It's a very big number. I'm not aware of any individual in Victoria or Australia who's gotten the virus more than once. There might be some case reports that are a bit ambiguous internationally about people having contracted it some months after getting it the first time. We haven't seen that in Australia at all, and it's either a very rare phenomenon or it doesn't actually occur, that people who are tested weeks and weeks later can sometimes turn up positive, but it's probably dead virus. They're probably not able to transmit it to others. So we're not getting people who are multiply infected. In terms of the stresses and strains on staffing, it's not insignificant. That especially applies in aged care. In our hospital system, nurses are more represented in these healthcare worker numbers than doctors. The number of doctors is much less. That I think relates to the closeness of interaction that nurses are engaged in with their care provision. But I think a lot of the numbers in healthcare workers are actually aged care workers and some of the ancillary staff in healthcare. That's a little bit easier to mobilise other individuals for specialist care. It's more of a strain, but it is being managed.
Welcome back, by the way. After
Thank
your
you.
retirement.
Yeah, it was a good retirement, short-lived.
On healthcare workers as well, with the infections that we're seeing, like it's about a third of cases today, how many are getting picked up in the workplace and how many are getting picked up in the wider community? I suppose you kind of touched on it, but if it's in the workplace, where does that suggest that things are going wrong? Like, does it show that PPE is fallible, or does it show that having problems with PPE and other things?
It is hard to know, and this is not my area. This is the Chief Medical Officer, Andrew Wilson, is looking into this with Safer Care Victoria. That it does require a really significant investigation to try and ascertain where healthcare workers have picked up their infection. Some of it will clearly be in the hospital setting, in the aged care setting. Some of it is outside, but it's not always easy to make a final determination because people don't necessarily know that they've been in contact with a positive case, either inside work or outside of work. We always have to kind of make assumptions that everything that can be done should be done in the workplace setting to make it as safe as possible. So the work that Safer Care Victoria is doing is being shared with hospital CEOs, and those hospital CEOs should absolutely take that information and work with their healthcare staff to make sure that everything is being done to protect them in the fullest way possible. If there are signals that PPE is insufficient, that should be fed back both into national guidance but also in the guidance that Victoria provides to healthcare workers, which, to be fair, is more conservative than existing national guidance.
Professor, the number of mystery cases was 107 yesterday, and now it's dropped to around 60. But what can we read, if anything, to that?
I think clearly we're going to work on watching mystery cases decrease over time, especially because, when you see the healthcare worker numbers that are new every day, when you see the outbreaks that are occurring every day, they have essentially started from a community member who's brought it into a setting where an outbreak's been allowed to occur. So as community cases decrease, we will see that decrease in outbreaks. We'll see a decrease in that last line of defence in our healthcare workers. So it really is critically important to get across and on top of that community transmission so that we don't see all of the effects of it coming into workplaces, coming into other settings where outbreaks occur. But the number that get resolved every day is really a little bit random. It depends on how many are closed off in the system. But we are watching the community transmission cases as a proportion of total cases every day, and it has come down from earlier in July. So that's a positive for sure.
Question for either the Premier or the Minister. Is there any consideration given to pushing exams back again, given stage 4?
Professor, are you confident that you are providing enough information to the other states about what's happening in Victoria right now?
Absolutely, I am. I mean, the daily 2-hour telephone calls with HPPC, I'm on those every single day, and I provide our case numbers, our outbreaks, including sensitive information. That's my daily update to HPPC. In relation to the dashboard, that information hadn't been made available because it hadn't been settled out of the National Public Health Intelligence Plan, and we needed to go into our database to understand exactly how to extract those metrics for national reporting purposes. As soon as that was done, that's been reported up, and it was Alan Cheng who had it in front of him on the day that it was put together. But
You refute those claims that Alan Cheng has provided more information than you did?
I would provide exactly the same information if it were in my hands to provide, so yes.
And obviously your phone was blown up on Tuesday. Do you know where those rumours, all seriousness, do you know where those rumours would have come from, who would have started them? Is there a rift between you and the government?
Absolutely not. I have absolutely no idea. Look, I think there's colour and movement in rumours that people get excited about for its own reason, but it was a complete surprise to me.
And are you confident, are you confident that you will see us through this pandemic?
Yes, we will get through this pandemic. The world will get through this pandemic, but I think we are well positioned in Victoria because we are doing the things that I know are required and the things that I know will work. There is no question that second waves are far, far more challenging than first waves.
Will you see us through this?
I will see us through this pandemic, yeah.
St Basil's is moving residents back over the next couple of days reported. Are you comfortable with that situation?
Well, again, private aged care is a Commonwealth regulated and funded area. I think the fact that residents are able to move back will be good for them. Clearly, they need to be meeting the standards in terms of the care and the training and the PPE that those residents deserve and require. But if that is in train, I know that the Victorian Aged Care Response Centre will be totally focused on making sure that that's coordinated between our acute care setting and that and St Basil's. But if it's happening, it means everyone's working together to make sure it's meeting appropriate standards.
Should the federal government be doing more in aged care? Or drop the ball?
Oh, I think the federal government is working very closely with us now, and everyone is totally committed to making sure that it works in the best way possible. There are clearly inherent vulnerabilities with an aged population in close quarters with a workforce that have actually come from our at-risk population with this pandemic. Though that was a perfect storm of vulnerabilities and risks coming together. But I think the fact that we're all in the State Control Centre talking through this every single day is a very positive development.
600 old people in the hospital before. Are they mainly in aged care? That's why the sort of distance between hospitalisations and ICU is quite stark there.
There are a significant number who have been decanted to acute care from aged care settings, but there are a number of others who are in their 50s and 60s who are getting more severe illness because of being in that age cohort who are hospitalised for that reason. So it's not all 80, 90 plus residents of aged care. There are certainly elderly members of the community outside of those settings who've been hospitalised because they've got severe illness.
And that 30-year-old that died this week, was that linked to his disability or aged care from hospitalisation?
Those elements aren't actually reported to me. I'm focused on the public health response about transmission of coronavirus. Those will be matters for the clinical teams that are engaged in that care. So it's not even information that I receive.
We saw yesterday with the postcode data, some postcodes had numbers above 300. Are they going to take a lot longer than the rest of the city and the state to come down? I mean, do you need extra sort of protocols for those areas?
Yeah, I think that the postcodes with the most significant transmission and the biggest case numbers will be our biggest challenges. But we're aware of the data that tells us that that's an area to focus on in terms of engagement, in terms of understanding the population there, in terms of understanding where transmission's occurring, and we'll have to work especially hard in those areas. But they may be the hardest to shift postcodes with respect to transmission, but we know where they are, and we know that we need to engage very closely with the communities to make sure that they can turn it around.
Brett, are you keeping data on the time between when someone tests positive and when contact tracing for all their contacts is completed? And if so, what is the average time that's
We are tracking all of those steps from the time that someone's tested to the time that it's received by the laboratory, that is processed, that the result comes through to us. We're working on each and every one of those steps to minimise the time as much as possible, including increasing the frequency of couriers to take those tests to the private labs. The private labs are working to make sure that they're distributing the work appropriately across all of the labs working in Melbourne to minimise that time. For reporting into our database, we're looking at any of the bottlenecks that might occur there. At the moment, the thing that I'm most satisfied with is that as soon as we've got notification of those cases, that those calls are happening, immediately. But we have to look at each and every one of those steps. We do have the metrics. I don't have it at hand.
Because there are reports that it takes 7, 8, 9, 10 days from when someone tests to all their contacts being contacted by the department. So do you have an average time of what that is and it becomes changed?
I don't know the average time for time of testing to time of follow-up with contact tracing, but I can look into it and try and get it for you. There will always be a distribution curve for these individuals. So the average time, for example, in getting a positive test result back being under 2 days is one element, but there will be individuals who are on the longer tail of that. We want to minimise that as much as possible, but it is that average time that's most important from a response perspective.
With some new Deputy Chief Health Officers coming in, is that a chance for a kind of reset and look at how you're doing things, and have you changed anything since that happened?
Oh, we've been changing. We've been looking at how we do things and changing it from day dot. The fact that we've got some very experienced infectious disease and other public health professionals in the team is absolutely an opportunity to bring fresh eyes to all of our processes, but also to bring their clinical experience about how we're working with health services to do our key work in the best way possible.
Just sorry, back on disabilities again. Have there been infections in state-run facilities?
I don't know. I can.
Should they be named so people understand what the situation in those facilities?
Yeah, we've named all of our outbreaks where those outbreaks have occurred. I'm all for openness around that reporting.
So we should be able to get the names of those.
I think so.
Thank you.
Just a question on hotel quarantine. You heard me yesterday that, as we all know, Jennifer Croak said that there's no problem in making comments about it. Can you just clarify when you were first made aware that there were problems in the hotels?
I knew about problems in hotel quarantine when it was in the media.
Is that how you found out?
Well, obviously, we were aware of outbreaks at the Stanford Hotel and the Rydges Hotel that my public health team responded to as outbreaks. So we were aware of the transmission that occurred. But in terms of other rumours and reporting around deficiencies with the workforce in those settings, the first I heard was when I read it in the newspapers.
So when did it become clear to you that it was the hotels drove really Victoria's second wave?
Well, when the genomics report came through was when I was aware that a very significant proportion of our current cases were linked to hotel
Do
quarantine.
you suspect it could have been the hotels before that?
No, I didn't really. I mean, it was information that was only available when that genomics report was through. We didn't have the epidemiological links back to hotel quarantine that allowed us to link all of those cases.
Did we achieve elimination of community transmission before these hotel cases?
It's impossible to say. We've got genomics for many cases in Victoria at the moment. There's no evidence of original virus in the genomics reports, but we haven't tested everyone. Not everyone can have the virus grown. For those who can have the virus grown, not everyone gets that genetic fingerprint. So we can't say for those individuals where we haven't got the genetic fingerprint. But where we do, there isn't evidence of a virus that goes back to February, March, April.
Can you say how much could be linked to the Rydges Hotel versus the Stanford outbreak?
Yeah, look, I don't know the proportions. I think the Stanford outbreak was more contained, but I don't know the proportions.
I've just got a question on childcare. I don't know if this is stuff. We're getting reports on childcare that some permits are being forged.